All right, today we're going to talk about aggressive lifestyle change.
Firstly, what does that mean? What's the difference between lifestyle change and aggressive lifestyle change?
Lots of people make lifestyle change, and usually lifestyle change to them means a one-off thing, I would probably say, right? So like you could say that doTERRA oils is a lifestyle change, right? Just saying that is a lifestyle change for some people. You could say going and doing Whole30, the book, is a lifestyle change for people, right? Mm-hmm. And I think that when you're looking at lifestyle change in a one-off solution, what we're actually hoping for is a quick fix. Versus aggressive lifestyle change would be really doing a life inventory is how I would perceive it, expect it. If somebody says, I have a feat, something that I want, a goal that seems too big for me to take on. And yet every time they go for that, they do a one-off lifestyle change. It doesn't work for most people. Mm-hmm. So I would say aggressive lifestyle change is taking a whole life inventory, not being spooky or scary, but just saying, okay, what am I doing in these different avenues depending on the goal? So like thinking through if somebody's like, I want to increase skeletal muscle mass. Okay, what does that mean? We're talking about stimulus, right? Mm-hmm. We're talking about making sure somebody's getting adequate protein. But if somebody just takes protein, like a lot of influencers are saying, that's all they do, I would consider that a lifestyle change. I would not consider that an aggressive lifestyle change. Okay. Make sense?
Yeah.
So perhaps an aggressive lifestyle change would be, I'm going to actually learn about my body and say, what does my body need? And not just learn it, but actually do something about it to stimulate muscle. Does my body respond to strength training from a body composition change perspective at all? Neutral? Enhanced? That would be a wonderful thing. Is that, knowing that information, is that aggressive lifestyle change? What would you say?
I would agree with you. I'm thinking aggressive lifestyle change is what a patient needs. Why are so many doctors afraid to prescribe it?
Well, I think most doctors would be flying blindly, right? And I would not want to, and I did not, when I was in primary care, prescribe aggressive lifestyle change. First of all, the word aggressive sounds scary. Mm-hmm. Sounds like something dangerous. Instead of saying it means all-encompassing, really trying to get after something. Most doctors are, like when I say flying blindly, they're not allowed to do the testing. They're not encouraged to do the testing. Insurance won't cover the testing for people to know these insights about themselves. So like that example, right, about body composition testing is strictly just about genetic tendency and knowing that about your body. Why would you not want to? So if we're going for a goal of increasing skeletal muscle mass, don't we want to know that? Mm-hmm. And I tricked you there for a minute. Would you say knowing that information alone and doing nothing else would be considered aggressive lifestyle change?
It's knowledge versus wisdom.
Right. It's also knowledge versus action, information versus transformation, right? So knowing that doesn't get skeletal muscle mass on people. They have to take the action. And the action, as we were kind of talking through earlier today, could be, is it in the form of a prescription, something that we're saying very dialed in from this clinic to you, this is what you need to do, mm-hmm. versus an action, which is, this is not something I can say, this is the exact supplement that would be for you, personalized, that your cells need based off of this testing. This is action is, I am trusting you that when I say you need to take this type of action outside of the clinic, 99.9% of the time, you're not going to have anything to do with the clinic. You're going to be living your life. That is the performative thing you need to do to get to your goal. Mm-hmm. That's what most doctors won't do. That's what most clinics won't do. That's why it's much easier to give somebody an Ozempic shot, send them on their way, and there's nothing else about their lifestyle or otherwise that changes. Going back to what is lifestyle versus aggressive lifestyle change, I would simply say lifestyle change is any change, and most often it's a one-off. Aggressive lifestyle change is looking at things in a confluence, and is looking at it in a manner of as much as we can, as is available, A to Z. A being, what are you doing? Starting off with that piece of data. What are you doing right now? You doing anything? You doing too much? You doing the wrong thing? All right. Well, now we know we've clocked you, we know what you're doing. Let's test you. Let's find out how your body responds to things. Your genetic tendency, not anybody else's, not Bill, Bob's, or Sue's, yours. And then based off of that information, what are you going to do? Because that's where the aggressive lifestyle change comes in. It's the action part.
So then it's on me what I do outside of the clinic to have success.
Absolutely.
So you have to trust me as a patient or a client to make the necessary lifestyle changes when you're not around.
Yeah, this is like teamwork. I mean, bad analogy, but let's say it's like drones and fires, right? I'm up in the drone and I'm telling you where to go to avoid a fire or where to put the fire out. But you have to go put out the fire. You have to avoid the fire. You have to deal with the fire. But we are the guide, and we're using very specific testing, but none of it means anything if you don't take action, aggressive lifestyle action.
And I think that's why most doctors would rather just prescribe you a supplement or Ozempic because they don't trust that you're going to make those changes.
It could be about trust, or it could be about they don't know. And this is a space that unless you're looking into Medicine 3.0, and I would even go so far as to say not all Medicine 3.0 clinics are created equal, okay? Not that they're bad or otherwise, but like Medicine 3.0 just is delineating that we're looking into a preventative modem, right? We are looking into understanding the body better. But even within Medicine 3.0, I would say there are striations of how that could play out, okay? And I think even our approach, while being in the lane of Medicine 3.0, that we're taking it another level because we are going actually directly into a cellular approach too. And I don't know that a lot of Medicine 3.0 clinics are doing that, okay? So, I very proudly say to any new client when we have our first consult, the first time you come into the clinic, you're not gonna walk into my clinic and see a wall of supplements that I can't wait to sell you. You got adrenal issues. You need your adrenal support supplement. Here's a jar. Oh, you're having some palpitations. Well, you need cardiac support. Here's a jar. That to me is the opposite of aggressive lifestyle change. That is a passive modality that's not based off of anything, especially if you're not doing intracellular testing. So in the cell testing, intracellular, in the cell, serum, what is circulating, right? Let's do a little spin off here. Let's talk about the game of biomarkers. What in the world does a biomarker mean? And I'm going to call fluff on some of this biomarker talk because you should be patting your primary care doctor on the back for a lot of these tests that you're paying only $200, $300, $500 for, and they're calling them biomarkers, which is a line by line, just looking at a complete blood count and saying those 25 things, each of those is a biomarker. I'm going to call fluff on that. And the reason I'm going to call fluff on that is because to me, what makes sense as a biomarker is knowing something that's going to have a longer term either impact or to be able to know how your body's been functioning at a longer term rather than an instantaneous minute to minute. So Nick, if I have you go get on a bike and you drank a little bit of water this morning and we grab your labs before you get on the bike, okay, and your kidney function is going to look probably okay. But I put you on that bike and you do 30 minutes of zone 2 cardio and you're sweating, and then we grab your labs again, you might look like you have some mild kidney issues. Because of mild dehydration, because it can happen that fast. It's an instantaneous thing. That's why when people are in the ICU and it's a very painful experience, they're getting their blood drawn every 2 hours because we're looking instantaneously. That's a serum blood draw. That is why I'm calling fluff a little bit on the biomarker game because it's not giving you long-term indicators of your health. And if you care about longevity, it really isn't. It's a screening minute to minute. Does that make sense?
Yeah, so how do I know when I'm looking for which blood test to get, what's a snapshot and what's not?
If it is, we'll kind of break this down. So the reason why these tests are powerful is because we want to know immediately if somebody is, for example, unconscious, we want to know what is going on. Is their pH off? Is their kidney function off? Are they in liver failure? Are they anemic? Are they grossly dehydrated? Are they septic? They got white blood cell count that's high because of massive infection. We want to know in that minute to minute. That's a useful thing. We are mostly cells. We are a little bit of circulation, but we are mostly cells. So when we are looking at stuff that's in circulation exclusively, we're missing an entire discussion about what's going on in the cells, what we are mostly made out of. So if we're going to talk about the biomarker game and say, oh, really, biomarkers, what we're saying is, for me, as a clinician and trying to give value to people and to be able to guide them appropriately, we want something that's going to be, what is a function, how is something really functioning, and or what is going on in the cell. So some examples of that would be, do you know how your cells actually withstand oxidative damage? So when we talk about free radicals and people talk about coenzyme Q10 and taking extra vitamin C and all these things that take basically the rust on a car that's happening in the cell, in our body, the equivalent, kind of biochemically, to go through and scour that out so the cells don't get damaged. What is your actual antioxidant function? Most people can't answer that. And it's a specific test. It's not an algorithmic test like a lot of stuff that's out there floating. It is a specific test to know, with your cells faced against a damaging agent, how can it do?
That's really important.
That is really important. And so there's that. And now we're in the season currently of massive flu, massive virus overload. What would be more important than looking at a complete blood count as far as immune function? I would say, I want to know, is my immune response robust, one, and enough for my age? Is it age appropriate? How do you do that? Well, you get a test that actually looks at your T lymphocytes and measures the rate of cellular division. T lymphocytes have a nucleus, just like if we took a biopsy of our tissue and we said, what's in it and how can it, if we put it in a petri dish, can it divide a nucleus? That's what T lymphocytes do. So if somebody's like, oh, my immune system's good, and some lab suite, online, AI-based, faceless thing is saying, we're going to tell you how your immune system is because basically we're going to take a complete blood count and say that that's a biomarker. I'm calling fluff on that. So I would want to know, what's my immune function? How good do my cells do that? I would want to know if I'm in the space of insulin resistance or diabetes, or I'm more sluggish and tired, or brain fog. I would want to know cellularly, how is my body responding to using different types of fuel? For example, carbohydrates, not just carbohydrates, fructose. If your cells are given, those T lymphocytes are given fructose exclusively, what happens to their rate of division? Does it diminish? Is it robust and appropriate? Or is it kind of lackluster? That is a direct vision into your immune system. That's a biomarker.
So it's just a more complete picture, and also it's not just a snapshot, it's looking over time.
Yes, but it also function. So the irony is that there is a lab company with maybe a similar name of a word I just used that is saying that, and they are not. They're these snapshot labs. They are not telling you long-term indicators of those cellular functions, that the information that actually moves the needle. What do we mean by moving the needle? This goes back to the original conversation of aggressive lifestyle change. So if you find out your cells are not responding well to fructose as a fuel source, and you are juicing, eating fruit every morning, you name it, and you continue to do that, just from a cellular efficiency perspective, not good for you, one. Two, from an immune perspective, because we literally just looked at the immune cells, not good for you. You're having some energy sluggishness. There's a chance of something called leptin resistance. That's a whole nother topic another time. But in the face of fructose, that will accelerate it and make you more fatigued because it downregulates your mitochondria, where you get your energy from in your cells, the organelles. So aggressive lifestyle change, again, is not just, oh, I'm going to get this test and I checked the box, I did the thing. I know where I'm at. What you do with that information, and that 99.9% that has nothing to do with us, that we are not over your shoulder, that's the aggressive lifestyle change. It's the choice of, oh, well, my spouse is going to continue to eat that fruit, and I already know I had this talk with doc. I'm not doing that.
You're not going to get results.
Yeah, if you continue to do the same thing, why would you not expect the same results? Why would you invest in labs that give you high-level insights if you're not willing to take it to the, what are you going to do with that? That's aggressive lifestyle change.
But it has to be frustrating knowing that someone can have all the information that they need, and then you send them out and nothing changes.
I don't know if the word is frustrating, if people are unwilling to take action to it, if clients are unwilling to take action to it, for example. It's more of why are people unwilling to take the steps to see the results, to change their life, to change how they feel, to change the pattern of where their longevity trajectory is going.
Because it's hard.
But is it?
I mean, if you tell somebody to start a new exercise routine and they're used to being comfortable, it's hard.
Every person, I would say, has a different definition of hard, right?
Yeah, definitely.
So if you're talking about habits and changing habits, that can be hard. But people have to pick their hard. Let's back up here. Changing how you work out and doing it blindly, I think actually that's the harder sell, which is you're doing something blindly, or you've been doing something for years that's not working for you, and you're unwilling to pull away from it because the truth is it's fear. What if I change what I'm doing and I put forth this effort and it doesn't work? and I have another failure. It's better just to stay with the failure that I already know. Maybe it's preventing me from getting worse, maybe not, but it's not actually achieving my goals, right? So what is somebody's hard? I mean, this is a big philosophical question that neither of us need to solve for anybody, but it's a good question for people to consider, because you're going to choose your heart of change or fear of trying something or finding out that you're weaker, literally physically stamina weaker than you thought you were. That is hard and scary and fearful. Or is it you want to pick the heart of, I'm going to go like this, la, 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 I don't know, I don't see nothing, and age poorly.
Yeah.
And not just that, age accelerated. I think that when the dust settles on the Ozempic and all the GLP-1s, I don't think that it's bad medicine. I don't think that it doesn't have a place. But I think we're going to see repercussions of this in a bigger way, and it's not going to play out for 10 or 15 years, okay? And so what hard do you want now? Do you want the hard that's going to make you more resilient, that's going to make you stronger now, that is setting you up for cellular success down the road? Or do you want the easy tool that's not teaching you anything about yourself? It's not, and not just that. We don't have the long-term data. If people are going to be upset about not having long-term data on things or risk or otherwise, we have just walked into another giant, we don't have long-term data on the effects of this. And I would be very concerned for most women who are perimenopausal, past, before, current, after, who start doing this, and they are not doing, not just strength training. I'm going to say this, it's not just strength training, it's effective strength training. And nobody knows what they're doing, if it's effective or not, unless you're testing.
Testing what?
So I would say at a easiest level, that's affordable, doesn't deal with insurance, it's a body composition test to see what your skeletal muscle mass is, see what your lean body mass is, because that's going to give you an indicator of how your bones are doing. If you're low in skeletal muscle mass, there is a high likelihood that those bones are already getting weak, because there's no stimulus to keep them on demand to have density, to maintain. So that's the path of least resistance. They're just going to whittle away. Minerals it's going to demineralize. No need. Body's efficient. Body always wants to stay efficient. Don't need the bone mass? Let's get rid of it. Less to carry around, less energy to use to carry it around, right? So body composition, I would say that's an easy indicator. You want to get more down the line? I'd say get a bone density test. Absolutely. Pay cash for it if your doctor won't do it. Get the bone density test, because even if you're okay now and you started Ozempic, check that bad boy in 2 years for sure and see what has changed. If you didn't change anything else, I would say get ready for a roller coaster to find out what else is happening from a bone density perspective.
So how do you approach people who are unwilling to become their own change agents to help them find that intrinsic motivation? What marker, what tests, what's the aha moment that the successful clients do have that start making change?
Well, I would say something interesting that we actually test on the genetic tendency. Okay, so anytime you do genetic testing, right, we're not giving you this is exactly what's going on in your body in this exact moment, because we know genetics can be influenced, right? But it's important to have the baseline to understand your genetic map, right? Because you can also influence something that may be beneficial to you, may not be working for you right now. You might not even have it turned on. We know we can turn genes on and off. That's the power of understanding your genes, is that when you know the good things, you can move in that direction. The things that aren't so great, you can move away from those and see what the impact is. But again, the key word there is doing something, not just knowing it about yourself. That's useless. Save the money if you just want to know, you're just in the information game and you don't actually want transformation, right? Do something. So what I was going to say is, in that genetic tendency testing, is that we can actually look at somebody's brain-derived neurotropic factor tendencies, okay, BDNF. In BDNF, we know people are, if they are more likely to be able to make it more readily, they're less likely for A, dementia, and B, they're more likely to be willing to work out, for example. Intrinsic motivation to work out, okay? So does that mean that every single person who comes back normal or good, optimized, we'll say, use that term, from a genetic tendency, that's the case? No. Does that make it a liar? No. Why? Well, I talked about something a little bit earlier called leptin resistance. If somebody has that at play as well, this downregulation of their mitochondria, and they literally are in a physically low energy state, Low energy, talking about thinking of a cell as a battery, and they have a broken battery cellularly. Well, it doesn't matter what their BDNF is. They feel like garbage. They're tired, they're fatigued, they can't fix it. They go to work out, they see other people working out, and they call them liars because those people say they are more energized and they feel better afterwards. But they don't. They feel worse. It's a broken battery. There's a pathway to get that battery fixed. Well, is it as simple as knowing, Doc says I may have leptin resistance. That's what's wrong with me. No, you do something about it. You take action off of that. That's more of a hypothesis that than most doctors will ever think about why somebody is chronically fatigued, and it's not depression. But that's what we go to, depression.
And you're going to teach me how to do something about it?
Yes. So one of those things is, look, can I put your legs on a bicycle and can they move without me helping you? Great. So if you said no, or I don't want them to, and I literally have to wrap my hands around your ankles and make you do this, who's getting the workout?
Right.
Okay. And is that appropriate for me to do that?
No.
All right. So why would we expect that that's how it's going to be?
Right.
But you're moving the football down the field if you know an execution path that makes sense for you, that's based off of science, right? So, actually, what next? Keep going.
I was just going to draw the comparison to, you don't go to a personal trainer and ask them to lift the weight for you, but they can spot you. They can teach you proper biomechanics.
Absolutely. Yeah. I mean, same thing. This is where, when you're looking at kind of a car analogy for people and their bodies, this is where you don't drive your car into Valvoline, get the oil change and drive out, and everything's better. No, this is where you're learning to change your own oil. You're figuring out what type of oil you put in there. You figure out exactly how tight you screw the cap on your filter so it doesn't leak again. So most things, I think, in the health and wellness space, right now, the accidental or intentional deception is that a one-off thing remedies anything permanently and in a healthy way. Okay, so healthy, what does healthy mean to me? Healthy doesn't mean necessarily natural. I don't mean this in a derogatory way, but there's lots of things that are natural, organic, whole food of this earth that are not going to move this needle alone in isolation, right? Those things are not bad, but I'm not going to deride those things based off of those properties as exclusively healthy. So, helping you. So how do you do that? Well, you get the map and you find out. So first of all, you got to do your inventory. What are you doing? What are you not doing? I've said it before, the guidance of saying change this and do this without somebody heeding also stop this. Don't just add things and stack things and more things. And I think that's actually where people get burnt out, is because it's like, what one more damn thing do I have to do to get to my goal? And the answer is, hopefully, you're getting to a space of learning about your body, you're appreciating it, you're feeling differently, that all this other stuff that you were doing was busy work. And so that the things that are not busy work that are going to move the needle for you, you're doing. And you're not doing busy work, right?
Yeah.
So, but you can't know what to do unless inventory, what are you doing? Secondary, testing, high-level testing, not biomarker, instantaneous, minute-to-minute testing, high-level testing. Then what? Then you need to know how to work out based off of your goals. Most Ohioans, we are going to be in a place where people are very honest that there is some level of known, or shortly after they get their body composition test, they find out that they have a higher % body fat than they thought. It's not working for them.
Or visceral fat.
Or visceral fat level, absolutely. It's not working for them, okay? And it's not working for them not because they have it, because then we can go and look at other longer-term labs showing longer-term organ indicators such as cholesterol and how the body's doing with that. We can go and get even more evidence if we need to and say, how long has this been at play? Well, let's go get a CT angiography with Clearly and find out if the plaque is in there. If there's plaque in your coronary arteries, okay, in your heart arteries, what kind is it? Is it calcified? That's the non-dangerous stuff. Is it non-calcified? Is it LDL that's remodeling and is the most dangerous because it's moving the most? What do you got? So even when we're looking at a calcified a coronary calcium score test, Nick, that is almost like you're looking into the past exclusively, or a false guarantee that in this moment you're okay. You don't know. And you and I have looked at charts of people who have done the CT angiography with Clearly, like the demo charts showing really horrific findings. They're redacted patient information, but they're real patients. And I think both of us are stunned that most of the plaque that is making these extreme narrowings is not calcified plaque. It's the non-calcified and the LDL remodeling plaque. So, again, you get this information, then what do you do with it? You take action on it. So even with the cholesterol, if you find out that you're somebody that's based off your genetic tendencies, that your cholesterol that we look at on a lab is likely to be sensitive to dietary fat intake, the fat that you consume may be muddling the picture of your cholesterol labs, what would you do? I would tell, and I do tell my patients, knock off the fat. Not all of it. We need some healthy fat, but like dramatically scale it back first. And let's see if that changes our picture of what's going on from your cholesterol. What does that take a willingness of?
Not much.
Not much, except for repeat testing. You want to go like this? You want to go like this? You don't want to know? Well, that's not useful, and I can't help you because this is based off of data. This is a Medicine 3.0 clinic. This is not a blindly looking at bad labs. These are high-powered labs, and there takes a level of follow-up to make the ability for movement.
And it's a great feeling not only when you start to see results on your body composition, but also when you start to see improvements in the cell testing.
Oh, absolutely. I'm going to ask you, what do you think is one of the most common lifestyle attributes that is absolutely getting in people's way? Not just getting in the way, is causing problems, but they will not let go of it. What do you think that is?
Alcohol.
Boom. And not just because, and patients have heard me screaming about this for years now, not because the former Surgeon General came out and said, yes, it's a carcinogen. Yes, we knew that. But if somebody is actually trying to make goal changes, energy, percent body fat, skeletal muscle mass, what's the tie into alcohol? Oh, alcohol is just bad. No, alcohol is bad if you're trying to increase your skeletal muscle mass because it squashes your testosterone, men and women. What do you need for skeletal muscle mass? You got to stimulate your testosterone. What else do you need to stimulate? Your growth hormone. When do those come out? When you sleep. What will get in the way of good sleep? Alcohol. What else will alcohol do? If you're not getting good sleep by a byproduct, it's going to raise your cortisol. What does cortisol do? Increases your fat stores.
It's a roller coaster.
You can't get off the train unless you get off the train. What more do you need? So if somebody says, I've got these big goals, doc, and this is what I want to do, and one of the first things, and I say this in the first consult with people, and I give them a literal medical article, a journal article that explains how bad alcohol is, okay, from a metabolic perspective, not just like it's cancer and da-da-da, but from a metabolic perspective. And if I find out that somebody is continuing to drink alcohol while they're saying they want these changes, I know they're not serious.
Right. It's like if you knew what alcohol was doing inside of your body, you would freak out.
Absolutely. But not just that. If you have pigeon-tailed and you know exactly what you want out of a goal, and this thing is in direct conflict with your goal, what kind of magic do you think either I or they, as a client, have the capability to work around biochemistry? That's magic. We don't do magic in this clinic. We do science. So I guess this gets going back to the aggressive lifestyle changes. If people really want to not have failure and they want to see these goals out, they have to own their inventory, they have to know what's going on, and they have to be willing actually truly to go after those goals through aggressive lifestyle change. Dibble-dabbling, testing without action, waste of money. Inventory without testing, waste of time. So you have to put the whole thing together, but you have to have the intentionality of what are you going to do after? And I think that word frustrating about aggressive lifestyle change, it's not frustrating. It literally makes zero sense to me why people are not taking action off of these high-powered labs.
Is that what's brought you to this method?
Absolutely. So I would say part of the reason why people don't want to change, why things feel hard, is because there's never a guarantee. And the truth is, there really can't be a guarantee unless you take the action to know. For every person's body, where they're starting metabolically, with their goals, everything, okay? And cellularly, the testing that we do, we look in the cells and know everybody starts at a different place. And so comparing every single person to every other person or a family member or a friend or otherwise is not wisdom, right? I would tell clients, if anybody is telling them that they are going to have results, and most of the time we're looking at some type of physicality results that are appreciable and helpful in moving in the right direction, right? If somebody's saying they want to lose 50 pounds in 2 weeks, that's not going to happen, right? So I'm saying reasonable, but knowing that their body is changing, I say 3 months, at least 3 months, at least 90 days. And this is why most people fail, because they're not doing anything consistently for 90 days. Worse though, some people that are doing things for 90 days or longer and they're not seeing results, that's a hard pill to swallow. They have no idea what they're basing anything that they're doing off of, except for effort. And I commend those people, absolutely. But effort and lots of effort and lots of movement and lots of exercise and all these other things can be working against somebody from a cortisol perspective. So again, you can do all this busy work, you can overstress your body and exhaust it, and people can be patting you on the back saying, look at all the stuff that you're doing, good on you, and you're sweating so hard and your heart rate's crazy while you're working out and you're persisting, and it's not working. And I guess my big question is, for anybody if that sounds familiar, to ask yourself, what are you basing what you're doing off of?
So it's not enough just to make the aggressive lifestyle change if it's in the wrong direction.
Absolutely. And because everybody's starting at a different place, from cell health, from immune function, from goals, different types of goals that they're going after. Like, there has to be an approach to try to remedy. So if somebody finds out that, my gosh, they've got like a dozen severe functional micronutrient deficiencies, meaning it's literally going to cause cellular dysfunction. It can't be that low. You can't take A to C if you don't have enough B. It's just not possible. Nothing comes out of thin air, okay? And so if that's somebody's storyline and it's really bad, that needs to be addressed immediately. In fact, I might not ask that person to start changing any of their physicality until they start getting at least on the right targeted supplement, because I don't want them burning out and working out and feeling terrible because their cells can't support the activity that they're putting the demand on their body. And there is to be demand on the body, but it needs to be targeted and there needs to be an approach to it. So same thing, am I going to have somebody completely stressed out, okay? And like they can tell you, you can see it, they may fidget, whatever, and tell them, oh, you immediately need to start changing how you're working out and do nothing but work out, which I would never tell anybody to do. But let's say the targeted exercise I ask people to do, like, that's what you need to do. You're totally stressed out and your sleep is terrible. That's going to work. That's not going to work. The sleep has to be addressed. The stress, in any way that we can mitigate it, control it, therapy, counseling, otherwise, that has to be a priority. That's aggressive lifestyle change. Because the physicality and the movement, we call it the movement RX, movement prescription that we do for people, part of that has to do with your sleep and your recovery and your stress.
So the foundations are the same, it's just the order in which we tackle them will change depending on your goals and your needs.
Yes, the foundations take the big lifestyle groups and help put them into some type of a container that's manageable. So instead of thinking about, oh, I listened to the Huberman podcast about circadian rhythm, but I don't understand the relevance to my life. Well, the relevance to your life is your cortisol level, your melatonin level, your ability to fall asleep and have quality sleep. How do you know that? You should be monitoring it. It's easy enough. You don't have to have some crazy sensors like you're getting a sleep apnea test. You put a good quality watch on and you find out and you figure out what the triggers are if you're not getting good sleep. If you're going to sleep even an hour later one night, the impact that makes. If you're eating 2 hours later than you normally do. If you have a treat and you eat something that you know is going to set you back, but then you see the impact even on your sleep. Alcohol, okay?
Exercise too close to bedtime.
Exercise too close to... Not only that, what if you're doing exercise at night and you get up first thing in the morning and you do exercise? That's a stress. That's a stress on the body. Very likely for most people, unless you're an elite athlete. And even then, downtime, recovery time. So doing more is not the answer. Being strategic is the answer. Being strategic off of what? Again, got your inventory, you have your testing, you have your action, your aggressive lifestyle change.
That's the method.
That's the method.